now go to the 1-minute poster presentations. And I would like to invite Lara Augusto to present her poster, please. And please keep stay aware of the time limit of 1 minute. Thank you. Please go ahead.
Can you hear me?
Yes.
Okay. Hi, good morning. I'm Lara, and I'm presenting the results on a survey on the knowledge and practices towards the control of anthelmintic infections. We managed to obtain a good amount of replies from across the country that allow us to conclude, among some other important points, that most of the livestock producer organizations deworm their flocks once a year, being ivermectin the most used product, that more than half of the veterinarians already doubted under some circumstances of the anthelmintic efficacy, and that more than half of the producers are not aware of the consequences of anthelmintic resistance. So this data supports the fact that there really needs to be an investment towards the dissemination of information to promote good anthelmintic usage and correct deworming practices across the whole country. So for more information, you can go and check my poster for more results. And if you have any questions, don't hesitate and send them to me. Thank you.
Thank you very much. Interesting. And just within 1 minute. Thanks.
Thank you.
Next presentation will be given by Maria Martinez Valadares. Please go ahead.
Thank you, Edwin. Well, the aim of this study was to determine the effect of anthelmintic treatment on milk yield in dairy flocks with different levels of infection by gastrointestinal nematodes. So in this study, next, yes, thank you. In this study, we included 8 flocks naturally infected by gastrointestinal nematodes, 4 with low level of X per gram in feces before partum, and 4 with high level of infection. So the fecal count reduction test was performed in all of them with netomidine, including 2 groups, treated and untreated animals. All flocks resulted susceptible to the treatment. Ewes belonging to the low level of infection flocks produce 125 kilograms more milk than ewes with high level of infection. A significant and negative correlation was found between the mean X per gram before treatment and the mean milk yield per flock. In relation to the effect of anthelmintic treatment, in low level of infection flocks, the treated ewes produce 9.6% more milk than the untreated ewes. However, in high level of infection flocks, treated ewes produce less milk than the untreated animals. In conclusion, the treatment of flocks, even with low level of infection, can improve the milk yield. The lack of treatment effect in the high level of infection flocks could be due to the fact that the ewes continued grazing on the same pastures after treatment, resulting in high levels of infection during lactation. Thank you very much.
Thank you, Maria. And the next speaker is Marcelo Molento. Marcelo, please go ahead.
Good morning, everyone. Can you see me?
Yes, and I can hear you too. Thanks. Perfect.
Fantastic. So the title of my talk is a meta-analysis looking for the macrocyclic lactones, but also with a second objective, which was to interview people and farmers to see if they have a different protocol for parasite control. So what we have done before was to go through the literature based on macrocyclic lactones resistance. So we gather a dozen of papers and we select them and to see what drugs they were using and etc. So you can see in this table the level of resistance after 21 days, and then the box you see the different dewormers based on macrocyclic lactones, which people use more than 10 times a year. Next. So then what we have done is to interview farmers for other protocols, and what it was revealing was that they use more than 20 times to control ticks and hornflies. So what we are seeing is that drug resistance based on helminth control is not the principal cause of drug resistance, even in nematodes. This would be due to a high level of drug use during the year for tick control and also for fly control. Okay, so this is it. Thank you so much. It's a pleasure to be here and a pleasure to see you all.